Have you been grinding your teeth and want to get your pain under control? Keep watching. I'm going to run through teeth grinding, what we call bruxism in the dental trade, and 5 simple tips to get it and any pain you're experiencing with it under control. This should help you sleep better, wake up feeling more refreshed, and prevent any headaches or neck pain that you might be experiencing. Make sure you stick around to the end of the video where I'll also be sharing some bonus tips on managing, looking after yourself and your teeth. We've been dealing with grinding in our practice for over 20 years with hundreds of happy patients, so we know how to help you. This is Dr. Cal from North Fitzroy Dental, where we believe in better teeth and better health. If you're new, then please click the subscribe button below, and I will try and include links for everything I'm discussing in the description box below. You may be waking up with headaches, neck pain, or jaw pain. It can be uncomfortable, it can cause you to lose sleep, and can even cause your partner to complain. This is usually stress related and you're not alone. 7 in 10 people will experience it at some point in their lives. It's quite often related to grinding your teeth while you're sleeping. This may also include clenching during the day. This places tension and strain on the muscles around your jaw joints and it may cause excruciating pain. The good news is with a few simple tips in this video, we will help you to make your life easier and to get your pain under control. So in this video, I'm going to run through the top 5 things that you can do to help stop your grinding. Tip 1. Treat your jaw muscles like any other sprained muscle. Rest them, have soft foods for a week such as pasta, soups and meals out of the slow cooker. Avoid any chewy foods that may make it worse. Chewing gum is a chief offender here. Also be wary of really hard foods such as nuts or ice cubes. These can all cause the muscles to overwork when they should be resting. Avoid opening too wide. If you need to yawn wide, then place your hand underneath and support your jaw. Finally, use hot wheat packs. Make sure they're not too hot first, or use cold packs to help soothe the muscles when they are sore. Tip 2. Take the painkillers. We recommend regular painkillers. Nurofen or ibuprofen is the best for this sort of pain. You can also take Panadol or paracetamol too. If it's really sore, then it's best to take these at regular intervals by following the instructions on the packet and set alarm reminders on your phone to remind you when to take them. Remember, if you're not sure about what is safe for you to take, then please speak to your doctor or your GP. Tip 3. Breathe and relax. Stress is a big factor in teeth grinding in adults. So here are a few ways to manage it and your muscles. During the day, your teeth should never meet unless you're eating. So feel your jaw muscles each side a few times each day, and if you're clenching or your jaw is closed, then stop. Breathe, relax your jaw, neck and shoulder muscles and let them go loose. Massages, yoga and Pilates have all been shown to help reduce stress levels as well as making you feel good by releasing endorphins. There are even now online classes so you can do it from the comfort of your own home. If the pain is really quite severe and you're really struggling, then we recommend looking at treatment with osteos or physios to help loosen the muscles and your joints up. We send our patients down the road to the neighborhood clinic. They have a great team of osteos who are used to dealing with jaw issues. As a disclaimer, we don't have any financial incentives for sending patients to them. They just look after our patients well and have a similar ethos to us. Tip 4. Botox. If you do suffer from it a lot, it may be worth finding a qualified health professional to give you Botox, who can place it into the masseter muscles, which are these ones here and here, and this helps cut down the pressure and tension that the muscles create. By having less pressure on the muscles, it can reduce the pain and symptoms. However, one major downside of this is it needs to be repeated regularly, and it can be nerve-wracking if you're scared of needles. Tip 5. A bite guard. This is a device made specifically for you by your dentist. You may be asking, how is it different from a sports mouth guard? Well, a sports mouth guard is like chewing on chewing gum. It's soft and squishy, and so your body grinds more on it, which in turn means your muscles work harder, and this means you get more pain. They do help to protect your teeth, but only until you bite through it, and it doesn't generally help with your symptoms and can sometimes make them worse. A bite guard made by a dentist is like biting on a hardseed or nut. Your body realizes how hard it is and it stops you clamping down to protect your teeth. This in turn means you place less pressure on your muscles when you grind, and so your symptoms will settle down. They usually last for many years if you look after them. They can save you thousands of dollars of dental treatment by preventing cracked and broken teeth, and they can also help to keep your pain under control and quite often will fully get rid of the pain. So now it's time for your 3 bonus tips and resources to help. The first one, I'm a big fan of the Resilience Project. Grinding can be related to stress. The Resilience Project has some simple tools and techniques to help manage your stress and build resilience. It could be really helpful for those of you with anxiety and depression. It also has its own app, and there are plenty of links on the website and on YouTube. The second thing is there are some great apps around for meditation to help manage your stress levels, such as Headspace and Insight Timer. I personally use Insight Timer with my kids at bedtime, part of their wind down routine. The third tip is for after you brush. Spit, don't rinse. This leaves some toothpaste on your teeth and it hardens them to help protect them from the damaging effects of grinding. So that wraps up our top 5 tips to help get your grinding under control and any pain related to it, as well as our 3 bonus tips. If you found this video helpful, then please like it, share it with anyone you know it may help, and feel free to check out our website northfitzroydental.com.au to find out more about us. Finally, please see the information box below for some further resources that we talked about in the video. See you next time.